Good afternoon, and welcome to Fridays with Friends. My name is Ananda Balru. I'm a staff attorney here at Coast to Coast Legal Aid of South Florida. Today, I'm here with Michael Hotelling from Smith Community Mental Health. Thank you for joining us today.
Thank you for inviting me.
Can you tell everyone a little bit about yourself and your role at Smith Community Mental Health?
Sure. I started my career as a program therapist up in New Jersey at the Jersey City Medical Center, where I was a therapist in a small program for 2 years. And then I kind of worked my way up and I became the director of adult services at that community mental health center. And in 2004, I moved to Florida and joined Smith Community Mental Health, where I've been ever since as the outpatient director.
All right, can you tell everyone about the mission of your organization?
Sure, we really want to provide compassionate care with a commitment to human dignity on a wide variety of an array of quality mental health services.
Okay, and what are some of the services that your organization provides to the community?
You know, I think we're lucky here at Smith because we do offer a wide variety of programming, not only for treatment, but also for prevention. So here at Smith, we have the outpatient department, which is the department that I am the manager of. I have a staff of over 20 clinicians that in pre-COVID go into the homes and provide therapy for children, adolescents, and adults throughout the county. We also have a comprehensive treatment program here. It's for kids that are struggling in their home schools because of their mental health symptoms. So those kids come here, they receive their schooling, and they receive therapeutic services throughout the day. So the teachers are provided by the Broward County School Board, and then each classroom has a behavior tech and a therapist assigned to it with two-way mirrors so that the therapist can always see what's going on. So that's for middle and high school. We also have a diversion program here where youth are diverted, their charges are dropped if they complete the diversion program, and those referrals come directly from the state attorney's office. We have a family strengthening program here, which is really aimed at keeping families together and not having children removed. So a good number of their referrals come through the Broward Sheriff's Child Protective Investigators. Not all, though, they can accept referrals from other sources also. And they provide an evidence-based model called Alternatives for Family Cognitive Behavioral Therapy. So it's a very scripted curriculum that their therapists follow. We have a variety of after-school and summer programs for elementary. And then there's another program that's for middle and high school students. We have a weekend respite program for kids whose families really need a break and can't get things done because of the child's mental health symptoms. Those families can schedule with the manager of that department, and they're open on Saturdays from 9 to 5. So the family gets a little break where they can get some things done. And we have a supported employment program here also, where during the school year, the youth learn employability skills, and then we find them jobs and pay them for the summer. And they have job coaches that go to the sites and see the kids. Our after school and summer programs are considered prevention. So there's really, while there is a therapist in those programs, it is more of a way to prevent the illness from happening. And then we have doctor services. We have a psychiatrist, 2 psychiatrists and a nurse practitioner on site that will see clients for medication management appointments.
All of those services are so remarkable. So how would someone apply for services at your organization?
You know, it's really very simple. For many years now, I have been the single point of contact. So people would just call me. If I'm not the right person or I'm not the right program, I can direct them to the right program. So they either call me or my assistant, Arlene Ramirez, and her phone number is the same as mine, 954-321-2296. My extension is 219, hers is 220. But we take all the referrals for the agency for the treatment programs. For the prevention programs, we would just link you with the correct manager.
Okay. And what are some of the requirements that for someone to qualify for services with your organization?
For the treatment programs, Medicaid is our primary funder, but we also have funds available for youth and adults who have no insurance. Obviously, for treatment, they would have to have a mental health diagnosis, but they don't have to come into us with a mental health diagnosis. We would do an assessment to see if they would qualify for services.
Okay.
And we do treat all diagnoses from adjustment disorders, right through schizophrenia and bipolar, so everything in between.
Okay. And how has your organization changed its method of services since COVID started?
Boy, was that a learning curve. And I think it was a learning curve for everybody. When the pandemic first hit, we had to quickly learn how to use telehealth, which was something none of us at this agency had ever used before. So we found a telehealth platform that we were able to utilize, making sure that it was HIPAA compliant. And so that's how 99% probably of our services are being provided right now, is through telehealth. I do have some clinicians that have started going back into the community to see the kids face-to-face or adults face-to-face, because while telehealth has been great in order to keep services going, I do think that when you're face-to-face with somebody, you see more of what could possibly be going on with the case. So, we are at this agency moving towards going back into the community and doing things safely, masked, social distancing, outside if possible, just to keep everyone safe.
Okay. And how can someone reach you with a question during this time?
They could, during this time, if they have access to chat, they can put it there. They can email me, but then my buzzer's going to be going off.
Well, just in general, how would someone be able to get in touch?
Either by my email, which is my name, but it's michael.hotelling@smithcmh.com, or they could call me at 954-321-2296, extension 219.
Thank you for that. And lastly, are there any upcoming events with your organization for the community?
Nothing on the docket right now. We have participated in some online resource fairs, but nothing that I see right now. We're hoping to get back to some semblance of normalcy and be able to do some events for our families.
Absolutely. Well, thank you so much for joining us today. We want to remind everyone how to get in touch with Smith Community Mental Health for services. So the Facebook page and website will be posted in the comments so everyone can get more information. Thank you for joining us, Mr. Hotelling, and providing helpful information about Smith Community Mental Health. Thank you everyone for watching, and don't forget to tune in on Fridays at noon for more segments of Fridays with Friends. We are live every Friday, bringing you updates and information about local services for our Broward community. Please remember to like and follow us on Facebook and YouTube at Coast to Coast Legal Aid for other important updates. Thank you. Have a great weekend.
Thank you.